Can AI replace doctors? AI tools such as ChatGPT and Gemini are already changing healthcare, but can they really replace human doctors? In this video, we'll talk about AI's current impact on medicine, how it's going to impact medical training in the future, and whether doctors should feel threatened. My name is Sal. I'm a doctor that's specializing both in kidney medicine as well as intensive care medicine, and I'm based in the United Kingdom. And I created this channel to discuss topics that are not very well taught in medical school or medical training. So these are my perspectives on AI. Number one, as doctors or medical professionals, it is our responsibility to engage and use AI as soon as possible. So why do I say that? AI use in healthcare isn't in some distant future, it's happening right now. Currently, we're still at the extremely early stages of AI, and its impact on medicine is still considered minimal. But even at this early stage, AI can scan thousands of medical records, can suggest treatments, and even help some patients plan their diets. For example, some kidney patients are using AI to suggest dietary plans that are tailored to their kidney disease. In one of Dr. Mike's interviews, he said that he was able to retrieve specific patient clinical details very quickly on a healthcare system that has got AI incorporated in it. The strengths of AI in medical field are limited at present, but very promising. And there are multiple ways that it can be an adjunct to our diagnostic capability and also alleviate workload in an already overworked and overstretched healthcare system. But most importantly, we need to use AI early so as to understand its limitations and weaknesses. At this early stage, AI is not perfect, but the general public is already using it. Patients are going to turn up to consultations pre-armed with AI-generated advice, which may conflict with our diagnosis and recommendations. And as doctors, we must be ready to address these conflicts confidently and clearly. Another reason why it's important for us doctors to engage in AI is that because it might become compulsory for us to do so. Remember that IT and data management are one of the 7 pillars of clinical governance, and AI usage will fall under this domain. Doctors ignoring the advancements of AI could potentially be seen as a failure to uphold clinical governance standards. Now, the second thing I want to talk about is how AI is going to impact our medical training. As AI continues to develop, our medical training will eventually have to evolve in order to keep pace. As mentioned earlier on, patients are already using AI to self-diagnose and to suggest treatments. They're going to come to our consultations pre-armed with AI-generated suggestions. Now, some of these AI-generated suggestions will inevitably clash with what the doctors are going to recommend. You might find yourself in a situation where you have to say to your patient, even though AI has suggested this treatment, my recommendation is this because of A, B, and C. Well, this means 2 things. Firstly, moving forward, your clinical reasoning has to be crystal clear. More than ever, you have to back every medical decision that you make with clear reasoning and evidence. Now, the other thing is moving forward, developing communication skills is even more important. Unlike the older models where doctors take a more paternalistic approach, instructing patients to do these investigations and take these treatments, doctors will have to negotiate treatment plans with their patients. Your communication skill set and your ability to negotiate with the patients is what's going to set apart an average doctor from an excellent one. I think medical schools are going to have to alter their medical curriculum in order to focus more time and attention in developing these communication skills. Now, apart from developing communication skills, the development of AI will also mean that we have to focus on another skill set, and that skill set is management. Managing AI will become a critical skill. Those of you who have used AI before will know that AI is not an autonomous problem solver. It needs to be guided. It is akin to having a team of members who are all very skilled individually, but all of them lack initiative. You are going to have to manage and guide this team in order to achieve a desired outcome. Using AI is the same. You're going to have to learn to manage AI effectively. Now, unfortunately, management is not a skill that comes naturally to everyone. For a lot of us, if not most of us, management is a skill that we have to learn and cultivate. In fact, this is a skill that's not taught well at all in medical school or in medical training. And so medical schools, as well as junior doctor training, will have to adjust the curriculum appropriately in order to focus on this appropriately. Now, in this last section, I want to touch on some of the limitations and weaknesses of using AI in this current stage. Now, remember, these AI learning models need a vast amount of good quality data in order to improve accuracy. Medical data, at least in the UK, is private and protected. This means that currently, AI does not have access to an adequate volume of good quality data in order to train properly. Another issue is that currently, AI does not have access to up-to-date peer-reviewed research data. During my exploration of AI, I found that access to peer-reviewed data is significantly limited. I've got additional concerns that AI training at the moment is influenced by outdated or unreliable sources, like information and answers that are provided by lay or non-medical people. And let's not forget that misinformation on the internet, more than ever, is very, very rampant. All this means that potentially advice generated by AI might be wrong or even potentially dangerous. Finally, let's not forget that AI can also have biases. If the data set that's used to train AI unintentionally excludes data from minority groups, it might give poor or even wrong advice for these patients. This not only becomes a technical issue, but an ethical one. So in closing, my thoughts is that AI will never be able to fully replace human doctors, but the shape of our training will have to evolve in order to keep pace with the evolution and the advancement of AI. It is important that we engage with AI early and develop the necessary skills in order to manage it. If we do this right, AI can process data, drive innovation, and support decision-making, whilst humans provide compassion, experience, and sound judgment. Together, this synergy has the potential to massively propel medicine in a positive direction. Now, in this video, find out what phone apps doctors use in order to save patients. I hope that helps.